Good evening, everybody. My name is Lori. HPV is a sexually transmitted infection. There are 12,000 new cases each day, which means 1 in 6 already have it, or they will have it at some point in their life. This information is provided by the CDC website. One of the local clinics that I work at, I'm a licensed practical nurse. Me and a group of other nurses, we help to educate the adults on HPV and the vaccination of Gardasil. We have provided educational handouts to offer out to people that are interested, as well as kept up to date by the website of the latest updates. My goal for this evening, by the time we are done, is to give you enough information where you can make an informative decision on Gardasil vaccination, as well as whether or not you think it's appropriate for your children. HPV, also known as human papillomavirus, is the fastest growing most sexually transmitted infection. It causes 75% of all cervical cases in women and 90% of most cases in men and women. This information is provided by the Merck Company educational handouts that I pass out at the clinic I work at. Females frequently get tested once a year at their annual checkups or pap smears. Men, they cannot get tested. This can lay dormant for up to 2 to 3 years before it could have symptoms. There are more than 100 different strains out there, 40 of which affect the genital area. This information is provided by the WW Mayo Clinic website. For most people, symptoms do not occur. Your body fights the infection. But those that do not, you could get a strain of genital warts or one of the various different types of cancer, such as cervical, penile, mouth, oral, or even upper respiratory type of cancer. There is no way to predict who may or may not get it. There are several risk factors for you to take into account, such as, do you smoke? Smoking can compromise your immune system, making you more susceptible for the infection. Proper diet is also to be a factor. If you do not eat a healthy, well-rounded diet, your immune system will not function properly. Also, the amount of partners you've had. The amount of partners will affect the outcome of how grave a chance you have of being exposed. HPV is transferred by skin-to-skin contact and skin to mucus. This information is provided by the Merck Company educational pamphlets that we offer out. Genital warts. They are flat, small, large, or can be cauliflower-like in appearance. There are skin-colored appendages that grows on the genital area. I have some pictures to show you. Is everybody able to see? Alright, thank you. Treatment for this is freezing, cutting, burning off, and frequently they reoccur within 2 to 3 months. This can be transferred even when there is not an active outbreak. Condoms do not fully protect you. There are certain parts of the genital area that are not covered that HPV can grow on. Every minute in the U.S. it is estimated that there is a new case of genital warts. That is 1,440 cases a day, 90% of which is caused by HPV. Cervical cancer is the lower part of the uterus that connects to the vagina. Is everybody able to see this picture? Mm-hmm. This is what a normal cervix looks like. This is one with the HPV strain. Thank you. 30 women a day are told that they have cervical cancer. This information is also passed to us by the Merck handout. American Cancer Society estimates 12,170 cases in 2012, killing 4,720 of them. Treatment options include chemo, hysterectomy, and radiation. pap smear information I'm about to tell you I got from the www.womenshealth.org website. A negative pap smear does not mean you don't have it. You could have the strain and it just be dormant right now. A positive pap smear does not necessarily prove that you have the cervical cancer or precancerous condition, because this could also indicate that there is just a genetic change. Further testing is required. Now that you know more about HPV and what it can lead to, let's talk about preventative measures. The main way to prevent this is abstinence. Since most people this is not an option for, there are a couple alternatives to lower your risk. Keeping one partner, the one partner's had you, keeping your partners to a minimum. Always keep in mind, when you're sleeping with one person, you're also sleeping with all their partners' partners and their partners' partners and so on. Getting vaccinated will protect you against the 4 main types. It is offered for females and males ages 9 to 26. If you have already been exposed to one strain, you can still get vaccinated because you can still be protected against the other 3 types. So for example, say you have a genital wart strain. You can still go ahead and have the vaccination. It'll protect you against cervical cancer and the other form of genital wart strain. Now that we have discussed HPV and how to prevent, let's move on to how we administer the vaccination and what is involved with this. Gardasil is a 3-shot series. Once you've decided you want it, you get your first dose, 2 months later you get your second dose, and 3 months later after your second dose you get your third and final dose. If for whatever reason you miss your due date on when your second one is due, for example, you get 2 weeks late, that is okay. You can always do it on the date it's due or after, and this will not mess up the series. But then your third one has to be 4 months from your second one. With series shots, you always want to do them on the date or after to keep the antibodies up. Each shot is IM, which is intramuscular, so we give your shot in the muscle, typically in the upper bicep. I'd alcohol the area, and then I'd use a needle, something like this, with 0.5 cc's of Gardasil. As you can see, it's not a really big, long needle. HPV is a widespread virus that will affect everybody at some point in their lifetime, or someone they know. Some will show symptoms, others will not. It is important to lessen your chances of contracting it and try to minimize your risks. For those of you who have children coming up in age of 9 to 26, you may want to think about bringing them into a local clinic or one of the doctor's offices to have them vaccinated. It is always better to be cautious and preventative rather than to be regretful later once it's too late. Thank you for your time.